Are you, or someone close to you, dealing with morning sickness? Sometimes it's a mild discomfort, but other times it can be much more serious and require medical attention. What follows are 20 signs of morning sickness, sorted from the most severe to the mildest. You can save this checklist to monitor yourself later, or send it to your friends so they can assess their own symptoms. Let us begin with the most serious level, the kind that needs a doctor's attention right away. We're starting here because these symptoms are urgent. They can be checked at home, and taking action early can make a real difference. You might not need to listen to all the levels, but if there's one section you absolutely must hear, it's this one. At the severe level, the first sign is you're vomiting more than 5 times a day and unable to keep any food or drink down. This is considered severe morning sickness. You might be dehydrated and losing electrolytes. You should see a doctor. Next, you're vomiting blood, or dark green, or gray fluids. That's a dangerous sign. You need to get emergency medical help immediately. Another sign, you've lost more than 5% of your pre-pregnancy weight due to even if you're not throwing up constantly. This is still a serious condition. You may need nutritional and medical support. Next up, you've been vomiting continuously for 2 or 3 days without any improvement. This kind of prolonged nausea should be addressed by a healthcare provider. And finally, for this level, you're dehydrated. Your mouth is dry, you're dizzy, and you're urinating less. These are signs of acute fluid loss. You need to rehydrate with electrolytes and get medical guidance. Now let's move to the moderate level. Symptoms that can usually be managed at home, but should be watched carefully. The first one is you feel nauseous all day, can't eat much, and even lose sleep from the discomfort. This can affect your strength and mood. Rest and a checkup may help. Next, you feel sick every time you smell food, soap, or even perfume. This is strong scent. Try avoiding those triggers. Eat cold or neutral-smelling foods. Another moderate sign, you feel lightheaded when you stand up, look pale, and feel weak. This might mean mild anemia or dehydration. Increase fluids and monitor your blood pressure. Then, you throw up after taking prenatal vitamins or iron supplements. That's not uncommon. Your body may not tolerate the type you're using. Consider switching brands with medical advice. Another one, you want to eat, but the smell puts you off so badly that you skip meals regularly. This is moderate nausea, and you should try mild, easy-to-digest snacks in small portions. One more sign at this level. You notice odd-looking stools after vomiting. That could be a digestive warning sign. Don't ignore it if it continues. Now we come to the mild level. These symptoms are common and often manageable without medical help. First, you feel a little sick in the morning but don't actually vomit. That's classic mild morning sickness. Very common. Then, your nausea comes in waves. You feel worse when tired, but okay at other times. Your body's adjusting. Try to rest more. Another common one. You're eating 70 to 80% of your usual meals, but feel slightly queasy when hungry or after eating. Try eating on time and splitting meals into smaller portions. Next, you feel a bit uncomfortable when smelling cooking odors, but you're still able to eat. That's mild scent sensitivity. Try cool foods or open windows while cooking. If you usually throw up in the late afternoon, that could be a routine pattern. Adjust your meal times or food choices. Some moms say they don't vomit but feel a racing heart or cold sweat when smelling certain foods. This is a mild reflex reaction. Just avoid those smells if possible. Also, you'll feel bloated or have slight indigestion after eating but still enjoy your meals. That's very light. Try yogurt or ginger tea to relieve it. Another one, you feel slightly nauseous when you're really hungry, but it goes away after eating. Totally normal. Always keep small snacks handy. And finally, you've been feeling better after a few weeks and can eat properly again. That's a great sign. Your body is adapting, and the morning sickness is easing off. Thanks for watching all the way through. Which level do you think you're at? Mild or severe? Morning sickness can be hard, but listening to your body is key. And don't hesitate to speak to a doctor if something doesn't feel right. If this video helped you understand your symptoms better, share it with another mom, and subscribe to Dr.Ha Healthcare for trusted pregnancy support. See you in the next video.